Hello everyone, my name is Tess and I will be the narrator in our Acted Out case study. So the case study we're talking about is on alcohol abuse. So the case study is about the police bring Dan to the emergency department of the local hospital around 9 p.m. His wife Carol called 911 when Dan came home violent and she began to fear for her safety. Dan was fired from his job due to refusing to follow supervisor's directions. Several bottles of liquor were found in his work area. Carol reports that Dan has been drinking since he came home. He bloodied her nose and punched her in the stomach when she poured the contents of a bottle from which he was drinking down the kitchen sink. The police bring Dan to the hospital in handcuffs, which his blood alcohol level measures 247 milligrams per deciliter. He's admitted to the detoxification unit with a diagnosis of alcohol intoxication. So some background on Dan. He's married to Carol for 12 years. He was a social drinker before being married. Drinking has increased over the years. He's under a lot of stress at work and does not like his job, boss, or coworkers. He has depression. He's never had a loving relationship with parents who are now deceased. Daily routine includes coming home, starts to drink immediately, and drinks until he passes out for the night. He refuses that he does not have a problem. So let's go check this out.
Carol, what are you doing with my alcohol?
What does it look like?
This is my alcohol.
I know exactly what it is.
Why are you
That's the funny
pouring
thing.
it out?
Do you
Carol?
look at yourself? Look at yourself.
I'm fine.
You're not fine. You're not. Stop.
Stop pouring my
Enough.
alcohol.
No.
Stop pouring my
Stop.
alcohol
I said
out.
stop. Stop.
Stop
Oh
pouring
my
it
gosh.
out.
I'm calling the
I'm
cops.
done
This
with
is
you.
ridiculous.
I'm
Get
done
back
with
with me.
you.
Hi, please hurry. My name is Carol. My husband just beat me. Please hurry. He's belligerent. He just stormed off and went outside the house. Please call him. No one knows what he's doing. Help, please.
Hi, Carol.
Hi, how are you?
Good. How are you doing?
Better.
Okay, good. How are you handling things?
It is difficult seeing him like that, but I think now that he really sees how bad it is, it's gonna improve from now.
Right. I just have a few questions of what life is like at home.
Mm-hmm.
So, what would you say Dan's normal routine is, on a daily basis?
Well, he gets up for work at 6:30, goes to work, comes home. 4, we have dinner, we hang out with the kids do their schoolwork, and then we watch a movie or something together, and then we go to bed. He might have a beer with dinner, but the way he was when I called the cops, that's now becoming a reoccurring thing.
So, this just started recently?
Yeah.
Is there any reason why he started drinking more?
Well, he talks about issues at work, but I didn't think it was that serious where he needs to beat me up, so
Okay.
yeah.
And then have you noticed any signs and symptoms that he's been experiencing?
Every time he gets drunk, he always is violent, his speech is slurred, he's just looks lanky, he cannot control his body.
So I'm Skylar, so I'll be the nurse. Well, I've been the nurse in this case study, in this little skit we're doing. So in the assessment phase in the hospital, when Dan comes in, it would be important for the nurse to assess the level of consciousness, their mental status, their vital signs, and it's important to take a urine sample and analysis. And as the nurse, it's important to establish trust and rapport, provide a safe and supportive environment for Dan and his wife Carol. And the nurse must be accepting and have a non-judgmental attitude. And you have to be professional, have a caring and accountable attitude as well, and also be an advocate for your patient, even if he came in for alcoholism. And also use therapeutic communication while talking with the wife and the patient, as in Dan. And the nurse would also want to do a drug history. So you would ask questions like, when did you have your first drink? When you were growing up, did anyone in your family drink? How long have you been drinking? Do you drink on a regular basis? You would take a whole drug history like that. And then you would also do an alcohol screening test. So there's a lot more questions, but I'll just go over a few. Do you feel you are a normal drinker? Does your wife ever worry or complain about your drinking? Can you stop drinking without a struggle after 1 or 2 drinks? Do you ever feel guilty about drinking? So, if Dan was here, I would ask all these assessments and questions as the nurse.
All right, so now we're gonna move on to the diagnosis. So the specific diagnosis that we chose for Dan include risk for injury towards self and others related to agitation and alcohol level of 247 milligrams per deciliter. So in the case study, as you saw, Dan was showing agitation and slurred speech and very uneven gait and slowed reaction time, which all those can put himself at risk for injury, and also the agitation, and even just he showed injury towards Carol. So that's why we put that as number 1. Number 2, we did denial related to alcohol abuse as manifested by statements such as, I don't have a problem with alcohol. So Dan, in the case study, Dan showed like very symptomatic signs of denial. He was saying, I don't have signs of I don't have a problem with alcohol. I can quit whenever I want. Delays seeking assistance. He might not perceive problems related to use of alcohol, minimizes use of substance, and unable to admit impact of disease on life pattern. And then number 3 is ineffective coping related to abuse of alcohol as manifested by depression and loss of his job. So this one's pretty self-explanatory, but destructive behavior towards others and self. As you saw in the case study, he was very destructive towards Carol. And he's an inability to meet basic needs, inability to meet the rule expectations, and risk-taking. And then for number 4, this isn't related to Dan's case, but you can put this as a diagnosis for people with alcohol abuse, is imbalanced nutrition. And that shows signs of such as like loss of weight, pale conjunctiva and mucous membranes, decreased skin turgor, electrolyte imbalance, anemia, and uses alcohol instead of eating.
So for our planning phase, we have 4 different steps for Dan to take. The first one we have is with his risk for injury. The patient, for his short-term goal, will have a stable condition within 3 days. His long-term goal is that he won't experience any injury. And then for his outcomes, hopefully Dan will accept his responsibility of his actions towards his wife and his behavior. And then he accepts addiction, that he has addiction, and then his feelings about his job. For the second one, we have denial. So for his short-term goal, he will focus on behavioral outcomes associated with the substance use rather than deflecting it and talking about other issues in his life. The long-term goal is that the patient will verbalize acceptance of the responsibility for his own behaviors towards his wife and his family, and especially for the people at his job he was working with, and acknowledge the association between substance and his personal problems and see how they do link together. For that outcome, he's going to verbalize correlation between the use of alcohol and personal problems, and then accept responsibility for his own behaviors instead of deflecting them to something else. For the third goal, we have ineffective coping. For the short-term goal with that, the patient will express true feelings about using the substance as a method of coping with his stress. The long-term goal will be the patient will be able to verbalize adaptive coping mechanisms to use instead of using his alcohol abuse in response to stress, and demonstrate how his mechanisms are helping him. And then for his outcome, he's going to verbalize and demonstrate adaptive coping strategies as an alternative to alcohol use and response to stress. Finally, we have imbalanced nutrition. So this one doesn't particularly pertain to Dan, but in general, for someone with alcohol abuse, they could have imbalanced nutrition as they're always going to be drinking instead of eating nutritious food. So if that's the case, the short-term goal is going to be an abnormal lab value will be restored to normal, and then the client will gain weight on a regular nutritious diet. The long-term goal is going to be that the patient will be free of signs and symptoms of malnutrition and dehydration. And then finally, the patient will have the outcome of a stable vital signs, blood pressure, and lab values, and then verbalize the importance of adequate nutrition for their personal health.
So moving on to the implementation phase of the nursing process, this involves the education and the interventions portion of this. So it's basically a long-term process, often beginning with detoxification and progressing towards total abstinence as an alcoholic who's abusing alcohol. So what are the causes of abuse? So this is something that we wanted to recognize and clarify. So in Dan's case, what caused him to abuse alcohol is losing his job, having depression, and maybe not having a relationship with his parents, and maybe marriage isn't going as smoothly as they've been married for over 12 years. It's important for the patient to accept their behavior and situation. So it's important for Dan to recognize what happened, like why he came to the hospital in handcuffs, talk to his wife. It's important to just him to accept the reality because he initially denied even having a problem to begin with. Now, it's important for them to also know like the effects of alcohol. So like not only the signs and symptoms of alcohol abuse is just like drowsiness, slurred speech, and violence, what we've already talked about, but also like what the long-term effects of alcohol abuse is. So that includes like heart problems, liver disease, cirrhosis of the liver, GI issues such as like ulcers and gastritis. And it's also important to talk with patients about positive coping methods, like not resorting to alcohol each time, so like developing a plan of action for them. So, maybe helping them find a hobby they enjoy or a sport that they might enjoy, or even just like going over like deep breathing exercises that they can do to control their stress, or even like having like sensory items like stress balls. So and it's also important to talk with the patient and help them to encourage, to verbalize their fears, triggers, their stressors, and their anxieties, because it's important to also help them open up to recognize important events in their life that the patient associates with alcohol. And last thing to do is, and the nursing role is to help them set limits in their life with the use of alcohol. So other interventions for Dan, so he would do detoxification, which, we want to detox some of the alcohol in their system. So we want to put them in a safe, supportive environment, administer substitution therapy as ordered. And then it's also important to educate about withdrawal and the signs and symptoms of withdrawal. So that can be tremors, nausea, vomiting, increased blood pressure, hallucinations, seizures, tachycardia, anxiety, and agitation. And another thing that Dan, our patient, also went through is rehabilitation. So in order to get better, it's important to participate in a long-term treatment because it's a long-term process. So an example would be AA, which is Alcohol Anonymous, and it's to maintain sobriety through helping of others. So basically in AA, people go to AA meetings every day. So each member is assigned a support person from whom he or she may seek help with when they have temptation to drink alcohol during that time. So each one has a support buddy that they go to when needed, and they also have someone to look out for them as well. And it exists in every community in the US, and it has 12 steps that they go through. And you can also have individual therapy with them, by yourself getting counseling instead of being in a self group or with other people. And you can also have motivational interviewing, which Dan didn't go through, but basically it's exploring and resolving ambivalence to improve health behaviors. And there's 4 principles of that. So that would be empathy, support, self-efficacy, develop goals and values, and to avoid argument and confrontation. And actually, this is effective in minimizing alcohol consumption among college students.
Okay, so now we're going to talk about pharmacologic interventions, some medications that you might see with someone who has alcohol abuse. So the first one's disulfiram or antabuse, which is a deterrent therapy, which is administered as a deterrent to drinking to individuals who abuse alcohol. So this medication creates discomfort for the individual, and if they ingested the alcohol, it'll create discomfort for the individual if they ingest the alcohol while med is in the body. And adverse reactions occur within 5 to 10 minutes of ingesting, such as flushed skin, throbbing pain of head and neck, respiratory difficulty, nausea, vomiting, dizziness, blurred vision, tachycardia, hyperventilation, hypotension, and confusion. And the biggest thing about this medication, it shouldn't be administered until it's certain that the patient is abstained from alcohol for at least 12 hours. And the contraindication is like any product with alcohol, like mouthwash, vanilla extract, etc., because that will cause an adverse reaction. So next is naltrexone, which is the brand names of Rivia or Vivitrol. And this is a narcotic antagonist used for alcohol addiction. It was originally used for heroin abuse, and participants on naltrexone therapy showed significantly lower overall relapse rates and fewer drinks per drinking day among clients who did resume drinking. And then finally, acamprosate, which is indicated for the maintenance of abstinence from alcohol in patients with alcohol addiction who are abstinent at treatment initiation. It's ineffective in clients who are undergone detox, and it's not achieved alcohol abstinence prior to beginning of treatment, and it's recommended to concomitant use with psychosocial therapy.
So what we learned today is that me, Dan, a former alcoholic, in the evaluation stage, I've accepted the fact that I do have an issue and I don't have denial about it anymore. I know how harmful my issue can be to others. I'm educated on things that could happen if I don't stop with my alcohol abuse, which is cirrhosis of the liver or disease. I can have heart problems that include hypertension, AFib, all the other things. I can have a stroke, heart failure, GI stuff, which includes gastritis and ulcers. We have blood sugar issues if I'm diabetic, or maybe if I'm not, I can become. And pancreatitis. All those things can happen if I don't stop my alcohol abuse. Then, when I was in detox, I was able to do it without any complications. And I did it safely in a safe environment. Substitution therapy is also what I learned with coping mechanisms. This includes AA meetings that I've gone to, and I adhere to the 12-step process. I learned how to communicate with myself truthfully. I've learned how to communicate with my wife and my practitioners.
Check this out.
Carol, are you
I'm
kidding
not
me?
doing this, Dan. Stop.
Stop doing on
This
my
is
alcohol.
ridiculous.
Stop
Get
doing
away
on
from
my
me. Seriously, this is ridiculous.
Stop! Stop! Dan! Stop! Seriously, you're right. You freaking